remarkable.
Do they also prevent more atherosclerosis from forming?
Absolutely, and there's unequivocal evidence. Research study involving hundreds of thousands of patients show that number one, it prevents stroke and heart attack, and number two, if you've had a heart attack or stroke, prevents a second one.
Now, how about diet? Does diet seem to do the same thing if it's followed extremely aggressively?
Diet's very important. Just because you take a medication doesn't mean you don't have to watch your diet.
So you still have to be heart healthy.
You still have to be heart healthy, exactly.
Nitroglycerin is a medication that people often carry with them if they've had a history of heart disease. If you've never had a heart attack, do you still need to carry on nitroglycerin? Now, I'm not talking about people who've never had anything. They've never had angina. They've never had any cardiac events. They've never had anything. They don't need to carry on nitroglycerin.
No, absolutely not.
Who should be carrying it around?
Exactly. Anyone, in my opinion, who said any kind of coronary event, meaning they have angina, or they've had bypass surgery, or they've had an angioplasty or stent, they have coronary disease. And I recommend to my patients that they do have nitroglycerin, either nitroglycerin spray, which I think is a good product and prefer, or the nitroglycerin tablets, which is also an excellent product but has to be kept fresh. Carry that with them or have it nearby and available.
Now, how long does it stay fresh? How long before you have to get a new supply?
Nitroglycerin, if it's kept properly, stored, nitroglycerin tablets,
right,
if it's stored properly, which is in a cool, dry place, will generally last in an unopened bottle about a year.
Well, most people keep it in their pocket.
Yeah, and that's not a cool, dry place.
Right.
So you do have to keep, in fact, I did some research on that about a third of patients with coronary disease have no prescription for nitroglycerin, and another third of patients with coronary disease are walking around with nitroglycerin that's expired.
Right.
The nitroglycerin spray tends to have a longer shelf life and lasts about 2 years.
Yeah, that was an excellent study that you did, by the way. I think that was really beneficial. We have patients who, now let's say the patient is woken up at 3 o'clock in the morning, they have the discomfort, maybe they have a little high blood pressure, they're over 60, maybe they used to be smokers. They go to the emergency room. It turns out, thank God, they didn't have a myocardial infarction. Maybe they had some angina, but the EKG, the tests that are done in the hospital show that nothing bad's happened, and they go home. What should they do next?
They certainly have to follow up with their doctor, and further testing in this situation is almost always required.
And what does that consist of? What testing would you
Most common
recommend?
testing is an exercise test of some form, and that can either be a standard treadmill test or a treadmill test which is accompanied by a picture, meaning an echocardiogram or a nuclear stress test.
Now, the exercise test, that's what's commonly known as a stress test.
Correct.
And what you're not really causing any stress. People think, oh my God, I'm going to be all stressed out.
Right.
What's really happening is that you're exercising the heart and you're seeing how it responds to increasing levels of exercise.
Exactly right.
And that, it seems to me a little bit risky, no? If you're sitting there and you're in the doctor's office and you're exercising and all of a sudden,
Thank goodness, it's actually one of the safest tests around. In fact, if you're going to exercise, exercising hooked up with a cardiologist and a nurse there and in a supervised, monitored setting is about the safest exercise you can do.
Yeah,
and
if you're going to have a heart attack, that's probably the best place.
And the risk of heart attack is extraordinarily low, extraordinarily low.
And when you do a test like that and you find that, now some people they're so out of shape they can't walk on the treadmill. What do you do in that circumstance?
There are what we call no exercise tests, which are sometimes called chemical stress tests.
Mm-hmm.
And those patients, in fact, we do a lot of testing for patients that are about to undergo orthopedic surgery. They're about to get their knee or hip replaced. They can't walk on a treadmill.
Right.
So we do chemical stress testing in our office with
pictures. And that's
pictures.
just as accurate.
It's extremely accurate. So if patients are concerned, I can't walk on a treadmill, have no fear of that. You definitely can be tested.
Now, is a stress test a test that you should get sort of like colonoscopy as a routine after a particular age?
No, actually, it's been shown that the routine stress test, the executive stress test, was found not to be very accurate.
Oh, interesting.
And it's best used, an exercise test is best used to analyze symptoms. So that patient that you mentioned who was in the emergency room, or the one that says, geez, I'm getting a little agita, I need to figure out what this is. That's where exercise testing is best used to analyze symptoms, and it is extremely safe and accurate.
So now you've got this patient, let's take the same patient, a little bit of discomfort, they end up in your office, they do a stress test, and it turns out that stress test there's evidence that there's coronary disease. Now obviously if there's severe disease, you're going to do something rather radical.
Correct.
That person is going to need various testing. And where would you send them next? Let's talk about
Sure.
severe disease. What happens?
If a person, and the exercise test gives us a pretty good clue as to what's going on. If we think there's severe disease, that patient is referred for a coronary angiogram or cardiac
And the angiogram is
catheterization.
going to show.
It will show where the blockages are.
And how
Remember,
much?
the heart is like the coronary arteries are like a tree. The arteries
Right.
look like a tree, and we need to determine, is the blockage in the trunk, a main trunk, or major branches, and what do we do?
So to quickly summarize, they would have an angiogram.
Correct.
The angiogram would show if there's severe blockage. If there's severe blockage, then what you're going to do is bypass it or use a stenting procedure to alleviate that. But let's take the person who actually doesn't need intervention. Or let's take a person who's already had intervention. They've already had a heart attack. What can that person do? Now, understand that there's a brand new process that we've offered at Phelps. In fact, I think we're the only people in Westchester that offer this procedure, which can actually increase the efficacy of the heart's function and maybe even improve blood flow to the heart. Could you tell us about that?
Exactly, and certainly cardiac rehabilitation is important, and use of medications. But when those type of modalities aren't as effective as we want, and they're not always as effective as we want, we have a new modality at Phelps called external counterpulsation, or ECP.
This is really exciting. Let's talk about that.
Well, the way to think about this, how this works, is that the heart is a pump, as you mentioned, and as the heart pumps, blood flows around the rest of the body, then the heart relaxes and blood returns. Now, ECP helps that process. Pressure cuffs are placed around the buttocks, thighs, the legs, and are synchronized contraction and relaxation to the cardiac cycle.
And this seems to improve cardiac function. Now, how often do you have to do this?
Well, it can be repeated, but generally what a standard session of ECP is 1 hour sessions, 35 1-hour sessions, which is generally done over about 7 weeks or so.
Now, this program goes to a lot of people who don't have physicians at Phelps or outside the immediate Phelps community. If they're interested in participating in this program, how can they get involved in it? How can they get their cardiologist involved?
They should speak to their doctor. Certainly they can call for more information. They can call the Phelps Cardiovascular Department, which is 366-3752. You can speak with Claire Zane, our director, and ask for more information about this.
Well, it's now another show has come to an end. This the external counterpulsation technique is something that I'd really like to stress as an opportunity that's now come to Westchester for people who have had cardiac events, either true infarction or have chronic angina. This sort of therapy combined with cardiac rehab is a way to prevent problems in the future and to actually improve your cardiac function. The message that needs to be brought home is that there are obvious risk factors. Those include smoking, diabetes, obesity, family history, hypertension. By controlling these particular factors, you can prevent cardiac disease, cardiac events, and even if you've had a cardiac event, and I'm sure Dr. Zimmerman agrees completely, by exercise, by cardiac rehab, you can reverse many of the problems that have occurred, and you can improve your cardiac status, hopefully preventing any events in the future. I hope that you've picked up some pointers. Dr. Zimmerman, it's been a real pleasure. Thanks for being with us today. I think that we've really done a service to our community by just getting the information out. Thanks so much.